It's Peter McCullough, right? He was talking about the spike proteins in the vaccines causing cardiovascular damage. And he's saying now that perhaps up to 15% of Americans who took the vaccine have some kind of new medical illness and openly regret taking the full regimen of shots and boosters. He mentions a drug called nattokinase.
Nattokinase.
What is it?
Nattokinase.
Something that could counteract the spike protein.
Yeah.
Spike. What do you say about that?
Yeah, I mean, it's very speculative. Is all I could say. You know, it's very speculative. It's a naturally occurring compound. I don't think there's nearly enough evidence, to suggest that it's going to combat the spike protein or how it would combat the spike protein in vivo in the body. I think there's some laboratory data, but
right. So a lot of our viewers took some or all of the vaccine regimen and boosters, right? And some of them, like the 15% that McCullough referenced, some of them might be regretting it. Some of them might have suffered some side effects. We don't know, but you can have myocarditis or pericarditis let me put it this way. Can you have either one of the two without knowing you do?
Oh, yeah. Yeah, you can have, yeah. And I mean, you can have it very mildly, or you can even have, tissue damage and scar. So
unless you did some kind of cardiogram or EKG or something like that, you might not know you have it.
Yeah, when active surveillance is done. So remember, the VAERS system and other systems that we use to monitor adverse events with vaccines are what are called passive systems. So people have to report in. It's not as if a large group of people taking the vaccine are put into a protocol where a few days after the first shot you have to come in for blood tests, maybe an electrocardiogram or something like that. A few days after the second shot you have to come in, and it's done routinely regardless of them experiencing very dramatic symptoms. It's an organized process. That's active surveillance. What the VAERS system is picking up are just spontaneous reports from people. And so certainly the less dramatic kind of presentations, let's say someone wasn't completely asymptomatic and just had a blood test abnormality, if they were in a surveillance program, but they had a mild form of chest pain. They said, oh, maybe it's just indigestion. It kind of went away. It faded. So all those kinds of things can be missed in a passive surveillance system. And right. I can tell you with the experience with both the smallpox vaccine, which had a very active surveillance program that was put into place years later, after they realized there was an association with myocarditis, they picked up an order of magnitude more. And there's a couple of small suggestive studies just looking at troponin, or which is a cardiac muscle enzyme that's released with damage. Just looking at changes in asymptomatic children, asymptomatic young adults, or just doing serial electrocardiograms. Again, Mike, in the absence of dramatic symptoms, just routine.
Yeah. All right.
You tend to pick up some evidence that there's something going on subclinically at a higher proportion.
All right. Do you know this guy, this Dr. Paul Marik?
I know of some of his work. Yeah. He's been looking at early treatment, particularly with ivermectin. And he
says here the spike protein is one of the most toxic proteins the human body has ever seen. Wow.
Yeah. Look, I mean, there's a lot of study that needs to be done. And now what's happening, Mike, to make muddy the waters even further, is there's a huge push for long COVID. There's a huge push for long COVID. There's all kinds of centers studying long COVID.
What do you mean a huge push for it? A publicity push to try to blame all ailments on long COVID?
Publicity, research dollars, very little for studying vaccine injury. I mean, Mike, we have a vaccine injury compensation program that we talked about it briefly once in the past. It's a horror. There are thousands of cases backlogged that they're not compensating in any way.
You just told me tells me
Excuse me.
indicates to me that they're going to try to blame vaccine-related harms on long
COVID. Well,
instead of on the vaccine itself.
that does seem to be a strategy. That does seem to
Wow.
be a strategy. And you know, long COVID has been studied, Mike, and I think we've also discussed this before.
Yeah, we have.
But if you look at the serious cases, the cases of COVID where there's a pneumonia, it requires hospitalization, in some cases ICU hospitalization. Absolutely, like any other serious pneumonia, whether it's viral, bacterial, fungal, there can be months of recuperation. And people may never, particularly if they're elderly, they may never get back to their morbid state. But when it comes to mild COVID, I mean, I think there's enough data now to show that other than possibly the loss of smell, there's really nothing going on.